So
Okay.
I would wait at least 2 or 3 minutes.
Okay, great.
And we can post the recording in the Teams channel and for people to look at later. And if there's slides, I can put them in there too if you send them to me, if you want them.
Okay, we'll wait. How about if I wait until 12:03 and then I'll get started.
Maureen is asking if there's a CME code. There is, but I don't know what it is. Christina manages that and hopefully is on or will be on soon. Put it in the chat.
So while we're waiting, I'll just note, I know folks have gotten a lot of emails from me in the last few weeks, so sorry about that. But it's our only way to communicate these days. Just to clarify, because I think I wasn't exactly clear, the restructuring of the conference will be at the end of February after the CME course is completed. So that's when we'll move into a bit of a difference around more advanced planning with the clinical case discussions and stuff, but I'll send a reminder email around that time. But I do encourage people to start using the Teams channel to share any information you have, and we'll start posting things from here and there too. And if you have any questions, just let me know.
Okay, great. Well, good morning or good afternoon now, everybody. Thanks for joining. I'm here with Nick Zussman, who is a consultant, expert in EPIC programming, has done a lot of great work. Definitely work on the dashboard and with this, but beyond for the whole, for all of Hopkins. So thank you, Nick, for joining us. So the purpose of today's talk or presentation is to go over a new tool in EPIC that was started by Richard, I think, and then carried on by Steve, and then I've taken it on with Nick in collaboration with Nick. And basically, it's to take this flow sheet that has been such a great tool for us. For those of you who haven't used the flow sheet, this is what we used in the Moore Clinic and now Bartlett Clinic. Some of us continue to use it to have a nice overview of a patient's history with their HIV illness. So that, this is the sort of the heart of the flow sheet, where you have, you can have a date, CD4 count, CD4%, viral load, if they were on therapy, any prophylaxis, and then any notes. And we have flow sheets from decades where we have what people's initial numbers were here. We would put the genotype here. We could indicate any special circumstances, and it was just a really nice snapshot of a patient's history of HIV and treatment. So here's an example of a flow sheet that was filled out. So what we've done is we have tried to incorporate that into the EMR, so into EPIC. And let me share my screen again. So I'm doing a partial screen in order to protect patient information, but I just want to orient you on what Nick and I have worked on. We built on something called the Synopsis, which I think in general, I use Synopsis just not for HIV, but there are some other there's like a diabetes synopsis that I use. There's an ambulatory synopsis, and it gives you sort of a snapshot of data from the EMR that's pulled surrounding a specific topic. So the way that you access Synopsis is you can have it on this top, and again, I'm not showing you your full Epic screen, but if you're in even if you're just doing like a chart review of a patient, or if you're in a patient visit or you're creating a documentation, you can access Synopsis. You can do this through these top tabs. I added Synopsis here because it wasn't on my top tab, and you can do that using this wrench feature where you can sort of pull things over that you like. You can reorder them. And even if you don't have it on this top tab, it's always under chart review, under Synopsis. So frequently when I am going into a patient chart, I'll do that. Like I like to sometimes do vitals, check their blood pressure trend. This diabetic profile is nice for seeing hemoglobin A1C trends, creatinine, things like that. So this HIV summary, this had been there before, but I worked with Nick to add some features that have elements of that flow sheet in it. So I'm going to spend the next bit of time just orienting you to this, because it feels a little unwieldy at first, but once you start playing around with it, I think I hope it will be helpful to you. So basically, to orient you, on this left-hand side are all of these different categories and data elements that will display both here. So this, think of the left side of the chart as being like the old flow sheet. So we have CD4 count, we have antiretroviral medications. I'm sorry, we have viral load, antiretroviral medications, genotype, and then there's some other things like right now it just has hepatitis serologies. We did antibiotics, so you'll see OI prophylaxis, you'll see treatment for STIs in there. We have weight, and then we included lipid labs. And then again, if you think of this side as being like the flow sheet, this right-hand side will graph whatever you check on this side of your screen. So if I want to see, and I do this with patients a lot, like if I want to show them how things are going with their viral load, with their CD4 count, I'll show them here graphically. For antiretroviral medications, these automatically check. And the time frame here right now is 2 years. So you're right when you open the synopsis, it's going to open and give you a 2-year look back. And again, this is pulling existing data from the EMR. So what you check here, you'll see over here, we did our, and then you can change the size of the panes, you know, by moving things around. We did our best with sort of, let me see if I can move this over a little bit, with the antiretroviral medications. It's a little bit clunky because it's pulling it from what you've ordered. And, you know, in the EMR, there's sort of different discrete names of the different medications. So you'll see here we have Biktarvy sort of coming up as 2 separate elements. And that's because one time I ordered it fell in this bucket in the discrete data in the EMR, and another time it came up as this. So that's a little bit clunky, but at least you can get all of the antiretrovirals that you've prescribed. And then you can, if I click it here, you can see it over here. And I feel like I'm a little concerned. I don't want to disclose this patient information. I'll try and move it over so you can see it better. But here is the Descovy, and here's deronaviricobacillstat he changed. And then here he was on Biktarvy for quite some time. So sometimes if you want to just view it and if you want to think about it like your flow sheet, then all I did there was I extended out this left-hand side of the chart. So it's like your flow sheet. So you could sort of scroll back and see over time. If I want to go back, let's say, I don't know how much is really in the EMR for 20 years. Let's see, 15 years. So one of the limitations for the antiretroviral medications is they are not pulled in before 2013. So that whatever kind of change that happened with the build, that data is not being pulled in. So again, in this sort of flow sheet view, it's not as nice and tight as our manual, but it's really just pulling everything in. So I can see if I scroll down here, I can see like his sort of genotype history. I'm not going to click on it because it's going to give you his patient information, but that's how you get the report is by clicking on it. It actually links directly to the result itself. We're not going to be able to have it all written out nicely the way that we do in our written flow sheets, but it is kind of I think a nice tool to see, what was their this over here on the right column is the most recent value, and then you can scroll back. And again, if whatever elements that I want to show over graphically, I can click on them over here. The same way that the medications come up multiple times, that's what's happening with these viral loads, because there are just different ways, different kinds of viral load labs that we used. So that's just to kind of give you an overview of how to navigate this snapshot. Couple other things, these question marks over here, that's going to be undetectable because there's no data. But you can even like take a picture of it, and you can insert the graphic into your notes. So I think I'm just going to pause now. I just wanted to sort of orient you to this. There's one more feature that involves this comments, where you can, like we had in our flow sheet, where you could take notes. It allows you to have a comment at, like if I wanted to make a comment here where I changed his medicine, right? That happened recently. I could put in a comment about that with that specific date. So, before I move on, Nick, do you have anything you want to add about the flow sheet or anything that I've presented so far?
I think that summed it up really well. The one thing I think I would add is encouraging you all, if you want to use this HIV summary synopsis view, is to personalize it and make it one of your favorite views. If you notice across the top, Joyce has their HIV summary, ambulatory vitals, diabetic profile, the three common ones that she mentioned. but there is a wrench icon right next to the time frame dropdown, and that's where you can configure which ones and the order in which they show up. So you can see the very first one listed there is a report called AMB Synopsis More with the display name HIV Summary. So Joyce has already moved that to the very first one. It may not show up as the first one if you have settings already in place to set your favorite Synopsis views. So that's just one thing to call out there, is to use that little wrench icon next to the time frame dropdown and put that HIV summary view all the way up at the top. And then you'll be able to see it first when you go into Synopsis.
Joyce, this is Richard. Before you move on, there's a couple of questions in the chat. I don't know if you
Okay,
want to deal
great.
with that now or wait till later.
No, I think that's fine. Do you mind? Let me see if I can pull.
I'll be happy to read them.
Yeah, if you don't mind reading them, that will.
Okay,
that will help me.
the first question had to do was, is HLA B5701 pulled in?
It's not. We looked at it. So Nick, I think we might. It's now a discrete element, and I can send you that data. In the past, it was uploaded into media, and so anything that doesn't show up as a discrete data element, we can't pull. But I believe the newer ones, it is. So we would be able to put, oh, here, yeah, we did. I did add it. I did email you about that. So it must be, I'll try and remember one of my patients for whom I did that recently. So it will show up if they have had that test done recently in this section. But for the older labs, when it was a scan into media, it's not going to show up.
Thank you, Joyce. Noreen Hines asked, given the need to refer at times to a patient's, will the full art history, which previous to 2013, do you suggest scanning the paper form into media? Is the paper form electronically available that way? If somebody wants to just send out all that.
Yeah, I mean, one of the things that I do is I try and do is and I'm hesitant to try and show you now. Here, I think I can do this without, I'm going to pause my share and I'm going to click to see if I can do this without revealing any, yeah, I think I can do this. So, like in problem list, here's kind of an overview. Yeah, I didn't do it for him, but like other people, I've been more extensive in terms of their history here. But unfortunately, we cannot pull it in. Potentially, what you could do is, and I'll do my best. I'm new to adding a flow sheet. You could add comments during certain dates. It's not going to show up on your graph here, but before 2013, you could put in a comment and indicate what they were on. I don't know, Nick, do you have any other ideas?
Yeah, I'm sorry, go ahead.
Yeah, I was going to say you should be able to abstract historical medications if you do want to get those in the system discreetly. Joyce, if you stop sharing for a second, I have a test patient pulled up so I can show where you would do that. So there is a medication review section that you'll see where it shows any of the meds that the patient is on. And if you add a new one, I just put in acetaminophen 500 here. There is actually a start and end date for that medication. So if you wanted to go back and abstract a historical med from before 2013, you could certainly do that. And then that would show up as a discrete value within the Synopsis activity.
That's great. So we can add that. Nick has put together some tips and tricks. It's not as extensive as it is for our dashboard, but Nick, would you be able to add that piece to the tips and tricks for the Synopsis?
Yeah, definitely. I can reach out to our training team and ask her to update that for us.
That would be great. Great question, Noreen, and I like that answer. That makes it more cohesive.
There's also a question about whether hepatitis labs are pulled in, and I think you said that they were.
So right now it's just serology. You can see, so what we did in order to get around the fact that new antiretroviral medication, thankfully, right? Like we have new medications that get added for antiretroviral medications, and then for the sort of antibiotics, we just did broad categories that get pulled in. So that you'll see this says antiviral medications. So you can see their history of Hep C treatment if they got Hep C, if it was before 2013. For the viral hepatitis labs, right now we only have hepatitis serologies. I could request that that other Hep B labs be added. So if people have suggestions of other data elements they would like to include, I can make those requests.
So one final question had to do with pulling in the labs from outside labs. And an example given, it was LabCorp or Quest for a GI patient,
Yeah.
for example. Or is this limited more to ones we ordered here?
Yeah, so some of the GI, some of the LabCorp labs do get pulled in automatically now, thankfully. I'm gonna share with you, I'm gonna pull up, in part of creating the dashboard, Nick created also a results console for us. I'm going to share my screen now, and I'll show that to you. So there's a way to enter labs from the outside. It's through something called an abstract encounter. So you create a new encounter, you make it as an abstract, and you select something called results console. And then we've built in here, Nick, he put in here, these different labs that I felt and others would be useful to be able to have available electronically. So that is able to be added in. It cannot be done automatically because of the nature of the data.
Finally, Ashwin commented that it might be helpful to have viral load data actually for both B and C hepatitis,
Yeah.
although he said particularly for B. So
yes, yeah,
we're asking
definitely.
for additional requests. That is one.
Great suggestions.
And Natasha, did you have one you thought would be need to be added?
So and before COBAS became the lab that we were defaulting to, there was like the HIV-1 RNA, I think from the early 2000s. I don't know if it's possible to add in those two as well, Joyce, just to help with the older viral loads from the early 2000s.
Yeah, we tried to be pretty inclusive. Let me pull up this patient because what you're only going to see, let me just, let me try and do this partial share and do it in a, okay, I'm going to just pause and pull up my patient again.
Okay, great. It is already in there.
Yeah. So, I mean, but if you all, like, part of how we were doing this build is I looked back at patients of mine who either had like really complicated histories and who'd been here for a long time. And I tried to identify things that weren't showing up, and I would ask if we could add them. So I think, you know, as you all play around with this, you know, like Ashman, if you don't mind sending me a quick email with your suggestions about Hep B and C labs, that would be awesome. And then, you know, everybody, you know, if there are things, and again, just keep in mind, it needs to be something that's sort of a discrete data element that could be pulled in.
The other thing that Joyce said might be helpful would be RPR titers as well. This is amazing though.
Yeah, so maybe like GC, CT, RPR results. So like STI.
Yeah.
Yeah.
It's really
Yeah,
fantastic.
these folders or sections within the synopsis are very easy to update. So if you come across a patient who has a very old viral load that maybe was interfaced in from a lab that was maybe a one-off, or they sent it in a little bit different than our internal lab or LabCorp request, you know, just send those on over to Joyce, and we can definitely get it updated. Once we have the structure in place, it's very easy to just add individual labs if we find any that are missing.
I was gonna, this is the thing. So the other thing, I'm sort of, again, new to doing the flow sheet piece, but let me demonstrate this last element that's part of the synopsis feature. So up here, you can see this comments. And this is where you can type in some prose at whatever date you're interested in. So I was saying with this patient on December 16th, I switched his antiretroviral medication, right? So here I can, the way for me to put comment is through flow sheets. So this is another thing where this flow sheet tab might not be there in your view. It was not there in my view, and I needed to add it. And you do that through this wrench. And you would find flow sheet over here, and then you could drag it up. So, so you go to flow sheets, and then you go to HIV synopsis. Is that what it's called, Nick?
I think we called it HIV narrative. If you just search for HIV, it should come up.
And again, this is one of these wrench things. So I'm going to add HIV narrative. And I'm going to move it up. Okay, so if I wanted to put in a date, I think it was like, what was it? It was December 16th. So I would say insert column. I would go to December 16th. And I would say headache with Biktarvy change to Revere plus TAF. Okay, and then when I go back to my synopsis, how do I have to do something, Nick, to sign it?
Yeah, if you go back over to synopsis, I think you'll just have to refresh the view in the top right-hand corner,
Okay.
right there.
Okay. And now there's a little note. So you could go back. So again, just to remind you what it is that we were sort of going for, right? Here's our old flow sheet. So we were really trying to have, you know, the capability that we have had with the written flow sheet you know, in the Epic flow sheet. So this is something, and again, just to kind of distinguish what's on the left-hand side, which functions more like the flow sheet, you can put in past dates, you know, for specific events. So I know like in our flow sheets, we used to do the dotted line to show, you know, poor adherence. You could make a comment about that if you wanted to, or anything else that you felt like you wanted some narrative to go along with an event that happened at a certain date or time for a patient. Are there other comments in the chat? New comments or questions? Let me see. No, okay. So if you all are interested, I could, and actually Nick, sorry, do you have any other, anything that you want to add? Besides what
no, just and you might have, maybe you were just about to say this, but just that we did put together 2 tip sheets for you all to look at to help with the new workflow. One is just a general tip sheet about what Synopsis is and how to use it. So how to get to the activity, how if you check those boxes, it creates a little graph on the right-hand side. And then we also put together a tip sheet specifically for the HIV summary synopsis. So it goes into a little bit more detail as far as the different folders that we have in the HIV summary, as well as that flow sheet that Joyce showed if you want to add some prose or a narrative to also display in the synopsis. So both of those tip sheets are published on our training portal. And there's also a link at the bottom to a quick little video that Epic has on how to use Synopsis. It emphasis on quick. I think it's maybe a minute long and goes very, very fast. So we wanted to make sure to give you a few screenshots as well.
We'll send out links to this. So yeah, thank you so much, Nick, for your work on this. It's really excellent. And you know, these tip sheets, again, this is sort of a general tip sheet about Synopsis. And then there's this specific one about HIV as well. So maybe I'll just do one last like quick sort of orientation. I'm not going to be onerous about it, but you can access Synopsis either through one of these top tabs. Remember the wrench. If you need to add elements to these tabs, this is how you can access Synopsis. This is how you can access flow sheets. And then you can also access it. It's always shown up. It always shows up here under encounters. You can access Synopsis that way. And remember this left-hand side, this acts like our flow sheet. You can change your date range up here. Importantly, if you change your date range and you want to have antiretroviral medications show up on your graph over here, you have to click them because when it first opens, it's going to automatically click the antiretrovirals they were on within the last 2 years, but then when you go back, you need to click, and then you'll click again whatever you want to see over here graphically on this right hand side. And then if you want to add comments, you do that through adding a flow sheet narrative. Okay. So I think we have some time. I can go over, I wanted to go over the dashboard with you all, not extensively, but just to remind everybody about that. As you all, I think most of the providers, you have received an email from me with a link to spreadsheets of your patients with tabs of their viral load status. So if they've had a viral load in the last 12 months and whether or not it's been above or below 200. And Sheila and I did sessions with the nurses to orient them on how to work the spreadsheets so that patients who aren't meeting the metrics for viral load could get connected with adherence or other support services as needed. So the way that we pulled the viral load data, and I'm just reconfiguring my screen so that you all can see. Okay, so this is the dashboard picture, and it always defaults to the ambulatory dashboard, but you can find your Bartlett dashboard, and we have tips and tricks for that. So yours would be called the Bartlett Clinic HIV My Panel metrics, and then you can put a star by it to favor it. So I have already favored mine. And so this has, in purple are the HIV related metrics. And then in green are the ones that are related to primary care. So the patients who are in the denominator for you for most of the HIV metrics are people for whom you're on the care team and they've been seen in our clinic within the last 2 years. For the patients who are on your primary care, the denominator there, those are patients for whom you're on the care team and you're listed as the PCP. So for each category, there's a specific sort of outcome. So this is the one we've been focusing a lot on. It's patients who have not had a viral load in the last 12 months and their viral load was greater than 200. So it was not less than 200. With each of these data elements, if you hover over the I, you can see what was in the numerator and what was in the denominator so that you know what the metric is telling you. And then what you can do, I'm not going to click on it because it will give specific patient data. But when you hover over it, you can see in the denominator the number of people who are potentially being evaluated in this category, and then the number of people who are in this what's an undesirable category here. So these are people whose last viral load was greater than 200. And it's doing these by quarters, so it's 2 years back, like the people who were seen in the last 2 years within the last quarter to date. And that's why these different numbers are different. If you then clicked on it, you would then see, and let me pause my share. I'm gonna pull up. So this again, it's all in this tips and tricks. And I think, with this kind of a thing, some of it's just playing around with it. If people have questions, you can feel free to ask me. I can meet with you. I can orient you and go through it. But let me just pull up what it would look like.
And I've actually got, Joyce, I pulled open some of the drill down reports and just minimized the columns with PHI.
Okay,
So I can actually show it'll be a little bit more clear,
Okay.
I think, than the tip
Great.
sheet.
So one thing I want to do then before, Nick, I turn it over to you to show what it looks like once you drill down. I want to show you all how to add someone to your care team. And this is, again, in the tips and tricks, but this is really a fundamental part of how the dashboard is created. And then also, Natasha, we had been messaging back and forth about how you get notified about
Yeah.
hospitalizations. So, okay, I'm not showing everything here again, but always on the left column of your patients, there's this PCP space, and you just click on that, and then let me see if I can. I'm going to pause my share for a second so I can hone in on it. And then you have this care team field. So I added myself as the PCP here. If you have someone who's like a GI patient and their PCP is at GI, you have the option of choosing yourself as an infectious disease PCP. That way, you know, you're basically sort of de facto doing all the PCP stuff, but it allows you to still have that general PCP who, you know, for payer purposes is the PCP. For this patient, I am both. You want to choose infectious diseases as the specialty. That's part of how they show up in the dashboard. And then I've chosen that I get all admissions, and then I can choose if I want to get results outside of the ones that I order. I could get in my inbox those. So and then as the nurses are going through their lists with you all and seeing patients, we're asking that they also add themselves to the care team. We're having navigators add themselves to the care team. And we hope to, like, eventually I'd like the nurses, they can have their own dashboard that will be pulled out of this patients for whom they're on the care team. All right, so I'm gonna stop my share, and like you can show more of what when you drill down what that looks like.
Yeah, so just to toggle back to the front page of the dashboard, as Joyce mentioned, if you hover over one of the percentage icons, you can see the numerator and denominator for a given metric. So for our patients without a recent HIV viral load less than 200, you can see that the value is 15%, or 19 out of 126 patients do not have a recent HIV viral load that is less than 200. If you click on this and then click on patient list, it allows you to go into a drill down report and figure out what the data is for which we're generating that 15% figure. I've hidden some columns here just so we don't show any PHI, but this is the drill down report that you'll see when you click on each one of those percentage indicators for each metric on the dashboard. The first column on the far left is titled metric. This shows a red X if they fall in the numerator. It'll show a green check mark if they have satisfied whatever you want them to satisfy for that metric. And then columns across the top show additional detail related to that metric. So for example, again, if we look at each metric on the dashboard and you hover over this eye icon, you can see exactly what the criteria is that determines whether the patient falls into the numerator or the denominator. So in this case, for the recent HIV viral load, you can see the description there is patients whose last recorded HIV viral load is greater than 200, or if they don't have one on file within the last year. So that's what we mean by recent is within the last year. So the two sort of key pieces of data that we'd want to look at are, one, what was their most recent HIV viral load, and two, what was the date of their most recent HIV viral load. So on the drill down report, we can see those two columns, their last HIV viral load, as well as the date of their last HIV viral load. And we can start to figure out why they are falling into the numerator for this particular metric. So you can see the vast majority of these is actually just because they don't have a recent HIV viral load within the last year. So even though their most recent one was 53 or less than detectable, we haven't had a value for that in well over a year. And so we're not counting them in the sort of satisfying this metric for if they have had a recent viral load. You can see for this patient, they have had one within the last year, but it was well over 200. And so again, that's why they're getting that red X falling into the bucket where they are not passing this metric. If you scroll down, you can see all of the folks with the green check marks. And those, again, are all of the ones who have a recent HIV viral load within the last year that is less than 200. And so you can see all of these patients looking at the HIV viral load value and their result date, that it's a recent one that is under that threshold. And you're going to see a different set of columns for each one of those drill downs that you look at. So for example, for patients overdue for breast cancer screening, you'll be able to see the last time they had a mammogram. For overdue for colon cancer screening, the last time they had a colonoscopy, et cetera. So each one of these drill down reports is going to give you a different set of columns that you can then look at to see why they are or why they are not meeting that particular metric. And then we've also got some additional columns that can show you some more information, such as when was the last time they were in clinic, when's the next time that they have a clinic visit scheduled. So you can see here pretty easily, here are some folks who haven't had a recent HIV viral load and we haven't seen them in quite some time. So you might want to reach out to them and get them in scheduled for an appointment. One additional thing that I want to show here is two different reports that you can see at the bottom. One is snapshot. I'm not going to click that because that's going to reveal some PHI. But if you just wanted to see things like their problem list or allergies or medications, you would be able to see a snapshot report with that information. The second is this one called HIV registry metric details. And this is intended to show you on a per patient basis what all of their metrics are that would feed into that dashboard. So all of the metrics that you see on your dashboard, patients overdue for an office visit, overdue for their STD screenings, overdue for their cancer screenings or cardiovascular risk, you'll be able to see how they fall on each one of those for that patient in one view. So you can see this was the start date of their ART medication. This was the viral load result date. This was their last viral load. This is their last LDL, their last time they had an LDL resulted, their most recent blood pressure value and date. So this HIV registry metric details report is sort of intended to show you for this patient, how are they doing on all of the metrics that we're tracking, not just the one that you're looking at right now, which is the HIV viral load. Kind of letting you see at a high level for this patient, how are they doing on all of the metrics that we want to track.
You can access that registry summary as well within the patient chart. So I'm gonna show that. Let me do my maneuvering here again.
And again, everything that I just showed is also in the dashboard tip sheet as well.
Okay. So within a patient chart, whenever you go to snapshot, I don't have it listed up here, but I can add it. If you say HIV, you see this HIV registry metrics. I'm gonna add it, so because I always want to have that. But then you can see for an individual patient, kind of a summary of where they are for each of these different metrics. For some of these screenings, there is a way, and again, it's in the dashboard tips and tricks, to say that somebody's shouldn't be in the denominator. So for some of these STD screens, maybe they're not sexually active. We've added that as like a health maintenance topic. There are people for whom there's an exception. In order to meet, for the primary care metrics in particular, we're just pulling that from ambulatory. So, so that whenever they update things, it automatically gets updated in our dashboard as well. So things like, how is it that you meet the metric for tobacco cessation counseling, things like that, they have specific criteria for how to meet those different metrics. I know it's, as I present this to you, I feel like it's just a lot of information. But I think, you know, we wanted to have a tool for you all to have a overall sense of, in terms of the dashboard, how your patients are doing, and then have the ability to go in and see the specific patients. And then if you want to have certain interventions, you could write from the chart, make a request for navigation, make a request for you know, case management, whatever kinds of outreach or adherence support or other support they may need. And then in terms of the HIV synopsis, again, that was designed to, you know, for your own patient, have all of that important HIV history and data just be pulled in, available for you to see, as we had been doing with the manual flow sheet.
I do see one comment in the chat. Is there a metric to list all needed and recommended immunizations and provide the dates when received? Joyce, I think we put a couple of metrics for immunizations, right? I think the Hep B maybe.
Yes, we have that for Hep B. We don't have, in the ambulatory dashboard, they have the influenza. And then within your individual patient chart, you get sort of a notification about what immunization.
Joyce, I think because they come in under health metrics on the regular encounter, I don't think we're including those because it tells you if you're up for health maintenance, because it comes in under health maintenance. So we decided not to put it on the dashboard because it was super crowded, right?
Yeah, I mean, you know, there's sort of the space in retail, you know, issues with adding too many things, but and yeah, and there is a prompt within the EMR to let you know that a patient is due for something when it comes to immunizations.
I just wanted to quickly take the opportunity to thank Joyce, who's been working really closely with Nick for doing this. I think we're trying to come up with ways to really improve our ability to take care of our patients in this really complicated scenario of Maryland PCP and a million things. And we wanted to put the HIV specific things together with the sort of ambulatory, regular primary care practice things that you should do, because there's ambulatory dashboard, but it doesn't tell you what you need to know about HIV. And then also to try to do something with flow sheet. I hadn't seen the most updated version, Joyce, so well done in trying to get all those pieces into one place. So that's awesome. And I just wanted to let you guys know that also we're looking at, as we get more track 2 money, if there are particular areas where you think that QI money could go to improve care. We're starting with blood pressures and with HIV viral loads during this time of COVID, but we could also highlight other things. We want to figure out how best to support you to take the best care of your patients, because I know it's gotten complicated and there's a lot that we're asking. So I'll leave it there just to say thank you very much, Joyce and Nick.
You're welcome. Thanks, everybody. Thank you so much, Nick. You've been really wonderful to work with. And again, I think, you know, for providers, for all of you, you know, if you can play around with these, give feedback, you know, whatever you think would be useful to add or to change. And if you want me to sit down with you, I can go through it with you. It just, like anything, it just takes some time to engage with, to learn how to use it and to optimize it.
Thank you all for your time. It's been great working with you too, Joyce. Please let me know any feedback that comes of this, and happy to help make any tweaks as needed.
Okay, thank you. And so Ethel made a note that patients with a viral load above 200, the ACTG 5359 study is opening. Ethel, do you want to, I mean, we have 3 minutes. Do you want to talk about the study?
Yeah, sure. So just to note that after a hiatus, we are likely to reopen to new enrollments in February. And this is a study of the long-acting antiretrovirals, cabotegravir and rilpivirine. It does involve a period of conventional triple drug antiretroviral therapy to get to suppressed in order to get their first injection, but we've been quite successful at our site with getting people to that point and have an almost 100% rate of transition to step 2, which is the long-acting injectable. This will slightly hasten potentially people's access to these agents, which are likely to get FDA approval in the next couple quarters of 2021. However, likely that package insert will say for use in people with a suppressed viral load as a transition or switch strategy. So this is one way our study coordinators have been incredible at maintaining communication, engagement, and just really serving as an extra adherence support for our patients who are having adherence difficulties, obviously using the full adherence resources of the Bartlett Clinic that are incredible, and then just a little extra. So please email me directly if you have anyone who comes up as not meeting that metric who you think could benefit from this study.
Thanks, Ethel. Also, Kathleen Page is the PI of the PCORI study, where anyone that you think could benefit from some extra support using an app, people are being randomized to either an app or no app with which they communicate with a navigator. So it's not viral load dependent, but if you have somebody who really the criteria is you think they could use some extra navigation support, you would make a referral for navigation. Right now, that's through messaging Stephen McDonald and Siobhan Solano. We're putting in an Epic referral soon. And then you can indicate they want navigation, and then PCORI is another piece where the patient would be randomized to either app or no app, and they do get some nominal financial compensation for their participation. Okay, we're at 1 o'clock. Thanks, everybody. Have a great weekend.
Thanks, Joyce.
Thanks, Matthew.